Good morning. I'm Congresswoman Michelle Lujan Grisham, and I'm delighted to get to say a few things and hello and welcome everyone this morning to the Lunch and Learn program sponsored by the University of New Mexico and the ECHO program. I want to do a special shout out to the director of the ECHO program and someone who's done so much for New Mexico, and that's Dr. Sanjeev Arora. I'm really delighted about the continuation of this program for caregivers. As some of you may know, and many others might not, I've been a caregiver for, quite frankly, most of my life. My sister was developmentally disabled and had significant health care problems, and so everyone in our family was a caregiver until her death when she was 21. I was a caregiver for my father until he died. I'm currently the primary caregiver for my mother, who lives here and for a long time lived with me directly here in Albuquerque. Caregiving is one of the most rewarding things that any of us can do in our families. It's also, quite frankly, one of the most challenging things that any of us will ever be called to do. Today in this country, there are more than 44 million caregivers. The net worth of our care is about $470 billion. That's more than the entire national Medicaid budget of $470 billion. If every one of us all reached out and required that our states or government assist us in providing and paying for the daily care, even if it, and we don't want that as the only option to us, if it was all nursing home care, it would quite literally bankrupt all of the current healthcare programs in this country. And so it's a great shout out to the incredible sacrifices and the impact that familial caregivers have on shoring it all up together. And you should also know that the majority of that caregiving, though not entirely, is by women and by women of color in this country. I also want to say that we're just going to have a growing problem. And I know that I'm preaching to the choir here, that by 2030, we're going to have nearly 72 million Americans who are 65 and older. And we know that the older you are, the more likely you are to need caregiving assistance. In just the next decade, we're going to need 1 million additional caregivers. So the long-term crisis in this country is real, and the way in which that we can do the very most by supporting it and shoring it up is by giving caregivers the education and tools to get a little bit of relief, but to also empower us to make the system a bit easier. That's where I think ECHO and certainly the University of New Mexico's programs really come into play. Because I know as a caregiver that if I have the tools necessary so that I have the most impact, whether I'm talking to another direct caregiver who's paid, whether I'm talking to a nurse or a therapist or a mental health worker or the primary care doc or the specialist or the hospitalist or the hospital or a specific long-term care program, I need to be armed with as much information as possible so that I can minimize the kind of confusion and mistakes and waiting. I could spend all day with you, the entire 4 hours you're going to be together, just talking about the spreadsheets I used to make, trying to track both with the payments I was making in terms of copays, in just Medicare alone, in Medicare Part D for prescription drugs, and just trying to navigate whether I had a drug that expired, was I supposed to get a new prescription, or did somebody make a decision not to do that drug anymore? Did I notice a behavior change? Am I noticing that maybe my mom's got a UTI and other infections, but that particular antibiotic's not working, or maybe it is, or maybe it was discontinued, or maybe it was just given in the hospital because they were looking at a different infection, and I know I am preaching to the choir trying to put it all together. Creating a lifeline, if you will, between caregivers and providers is really the key at making sure that while we're focusing on the highest level of independence for the individuals that we love and we're providing care for, we have to have those kinds of supports. In addition, I want you to know about a program that I think can make a remarkable difference in this country that deals with not only making sure that caregivers don't get sick and don't get exhausted and don't have to quit or leave work. And then there's a whole other set of really difficult statistics about the number of caregivers who have to go from full-time to part-time or can't work at all, and they're minimizing their own Social Security and retirement benefits by changing their workplace efforts, right? Because they're caregiving, and that the fact that we're all dipping into our savings because none of the resources that our loved ones have are sufficient to meet all of their both their medical and healthcare needs, but just their well-being and companionship and entertainment and all of the rest of it, right? It just doesn't all to come together in a very productive way. So I've introduced legislation in Congress called CareCorps, and it would literally create, like the Peace Corps, a whole new national service project for caregivers in this country, which means young people, and not just young people. It can be older folks, it could be retirees, it can be folks who have graduated from college, it can be folks who have started college and are interrupting before they go to graduate school. We would create a training national service program where we would provide housing and stipends and health care benefits, and we would pay back student loans, or we would pay forward getting you health care degrees and certifications, so that you would have an unskilled, and I don't even like the way that sounds, but someone that doesn't have to be licensed or certified, who could be available to my mom, who would take her to lunch, who would let me know if there's been a shift or a change, whether or not prescription drugs got delivered when they were supposed to. Or for my mom, I have to have a daily set of Diet Cokes that are delivered by the grocery store every single day. And if that doesn't happen, in fact, my mom really does have a significant behavior change that's unfair to her and to the residents that she lives with during the week when I'm in Washington, D.C. in her small assisted living. I need someone who lets me know if that's happening, somebody who can run errands, somebody who can go with my mother when she has a doctor's appointment so that I'm getting the information in real time about what's occurring, who can help cue my mom to answer questions so she doesn't feel so isolated and alone. I see tremendous potential for this program. And if I can't get it passed in the next 10 months in a Congress that you might have noticed is a bit dysfunctional and doesn't seem to have all of its priorities right, these are things that states can pass. And I see great potential for a program like ECHO to be that training component, whether it's statewide or nationally, for a CareCorps demonstration program. So I want to end with this. Thank you for being caregivers. Again, the rewards about my relationship with my mom are too numerous to mention, but the risks for caregivers are the same. And we know that for many situations, caregivers actually give out earlier, first, than they do for the people who they are providing, their loved ones that they are providing care to. Anything that we can do that shores you up, that provides the kinds of resources and tools for you to do the best possible job and to get the kind of relief that you need will make a difference. And so I know that UNM is doing that today, and I am so grateful, and I'm so honored that I got a chance to say thank you and to provide the kind of feedback and support that we all need in our caregiving duties and jobs. It is a job of love at the end of the day. Thank you again for participating. Thank you to the University of New Mexico for hosting, and thank you for an innovative, now national and international program like ECHO that understands that they have the power to make a difference in all of our lives. Have a great training.